Hello, and welcome to our Spirit of Women program. When it comes to health information, it's important to separate facts from fiction. In tonight's program, we're going to talk about health myths and facts. Also, the Genesis Food and Nutrition Services team will debunk some common food myths and teach us how to be conscious consumers. Be sure to add your name in the comments during the live broadcasts for a chance to enter to win a door prize from our Spirit of Women business partners. To get our program started, I'd like to introduce to you Lawrence Uhl, Practice Administrator with Genesis Physician Services. Welcome, Lawrence.
Thanks, Linda. You know, it's interesting in our world today. You can find health information making headlines everywhere on social media and TV. It can be hard to know what is fact and what is myth. Your doctor is your best source to get the facts. Tonight, we have asked Dr. Anastasia Gevas to give us the facts. Dr. Gevas is a physician with our Genesis Primary Care Group located at 751 Forest Avenue, Suite 303. She specializes in internal medicine. She completed her Doctor of Osteopathic Medicine in West Virginia and then completed her internal medicine residency at Southeastern Health in North Carolina. Dr. Gevas has received numerous awards over the course of her residency and is a member of the American College of Physicians Internal Medicine. Welcome, Dr. Gevas.
Thanks for having me. I'm glad to be here.
We have a few myths that we would like to go over with you today and get some facts about. Our first myth is that you should get 10,000 steps daily to be healthy.
While we're used to seeing 10,000 as a magic number for our daily goal, this number is actually arbitrary. In fact, the number is not a miracle solution it's often presented to be. In a recent study, it was found that you may be able to reap health benefits by taking half of that number of steps each day. Older women especially, researchers found that taking as few as 4,400 steps per day was associated with a 41% lower risk of dying. Also, it doesn't seem to matter if you take those steps by power walking, doing cardio, or just cleaning your house and running errands to get the same benefits.
That's really great to know. Next one that I wanted to talk about was that you should stay away from gluten to improve your diet.
With so many people on gluten-free diets these days, it's hard to avoid the notion that gluten is bad for you. If you have a gluten-related disorder, such as celiac disease or gluten intolerance, you should avoid gluten because it can cause an adverse reaction that can lead to serious health problems. Just because something is gluten-free doesn't necessarily mean it's healthier. For the average healthy individual, going gluten-free is not the key to health. Instead, it's your overall food choices that can help determine how healthy you are.
That's really great information. Here's another one that we hear a lot about. Is it true that you should drink 8 glasses of water a day or you'll get dehydrated?
This is not necessarily true. If your urine is dark yellow, make sure you're getting enough fluid. But 8 is not a miracle number. Studies show people who drink a glass of water when they're thirsty typically get enough fluids to prevent dehydration. Plus, beverages of other types and foods you eat also help get the fluids you need. There's no one amount of water that is tailored to each individual person. Normal adults are considered to have a minimum water intake of approximately 1,600 milliliters a day, equal to roughly 7 8-ounce glasses per day. However, many factors apply to certain people, such as those who are physically inactive, hospitalized, have surgical drains, or have GI losses, and even people with chronic heart failure actually are instructed by their physicians not to drink too much water, as it causes stress on the heart due to increasing the volume of the body to pump. For these reasons, it's best to talk to your doctor if you have any specific medical problems. Otherwise, drinking 8 glasses of water a day is typically recommended.
Weight loss is always a topic of discussion for people, and I wanted to know whether or not it was true that you need to eat breakfast to make weight loss successful.
This is a very common one, Lawrence. Eating breakfast is a successful strategy for some, but it can help prevent you from eating more during the day, not in all individuals. Not everybody is a fan of breakfast, and in fact there was a study done at Cornell that found that non-breakfast eaters didn't overeat at lunch and dinner, and instead they actually ended up eating less calories a day, approximately 400. Skipping breakfast may help some people lose weight after all.
This one is common in primary care, and we hear it all the time, that if you have green mucus, you have a bacterial infection and you need an antibiotic.
This is another one, Lawrence, that I hear often from my patients. Only a lab test can determine if it's actually an infection. While it's true that green or yellow mucus can indicate a bacterial infection, it's not a sure sign, and it certainly doesn't mean that you should begin taking an antibiotic. If you aren't sure if it's a common cold or an infection that may require an antibiotic, talk with your healthcare provider.
One that tends to be pervasive is that if you get a flu shot, that you will get the flu.
I hear this one all the time too, and many people have heard it and heard it from friends and family. But this myth is actually false, because flu vaccines are either made with no virus at all or an inactive flu virus. This means you won't get the flu from getting a shot. However, you may get some side effects such as a low-grade fever, headache, muscle ache, soreness, redness, or even swelling where the shot was given. These side effects are not actually the flu, and fortunately, they typically go away. This is mostly your body's response to building up an immunity against the flu, and so you're going to feel a little run down, but it's not the actual flu that you'll be receiving.
Baldness is often a concern that comes up in our practices. Will blow drying your hair or wearing a hat cause baldness?
This is actually a new one that I haven't heard, Lawrence. Blow drying your hair or wearing a hat will not necessarily cause you to go bald, but there is a form of hair loss called traction alopecia. This results from prolonged repetitive tension on the hair. Some examples of this are tight ponytails, hair extensions, braids, even hair weaves, along with many other types of hairstyles. Initially, it's reversible if the cause of the traction is discontinued, but if it's persistent, irreversible damage to the hair follicles can occur. There are many different types of hair loss with a variety of causes from poor diet to genetics, so it's important to discuss with your doctor if you are having symptoms to determine the diagnosis and if any treatment is possible. And also, one important note about hair loss is that the sooner you go to your doctor to discuss it, the better, because once you have scarring on your scalp, it's very hard to get any of the hair to regrow.
Multivitamins are often a topic of discussion. Does taking a vitamin supplement such as vitamin C, D, echinacea, or zinc keep you from getting a cold?
Well, not one single vitamin or supplement can ensure you never get a cold. There is some truth to the following. Vitamin D has been shown to boost your immune system and help fight off infections, and zinc has also been shown to decrease inflammation. However, the echinacea has had multiple studies that didn't show any statistically significant evidence that it's better than a placebo in preventing or treating respiratory infections. Not all studies are statistically significant, and it's important to discuss with your doctor if you are taking any over-the-counter supplements or vitamins, as you may start taking some that can interfere with medications you're already on.
Dr. Gevas, this past year has been really rough with COVID-19, so let's talk about the virus and the vaccine. All right, first question. We've heard that hair dryers can kill COVID-19. Is that true?
This is a new one, Lawrence. I actually haven't heard this myth before, but there's no evidence that hair dryers kill the virus, unfortunately. Otherwise, this would probably be off the markets just like the toilet paper was when the pandemic started.
Another question. Ibuprofen can make COVID-19 infection worse. Is that accurate?
So this was a hypothesis that started right when COVID-19 came out. And then studies actually showed that there was no difference in the infection severity with or without ibuprofen use, and it was safe to treat COVID-19 symptoms.
We've heard a lot about the vaccine early on, and there was some information out there that perhaps a microchip could be in the vaccine or that it would alter somebody's DNA. Is any of that accurate?
This is also a new one, Lawrence. I haven't had any patients ask me this, but no, there is no microchip in the vaccine, nor does it change the DNA of the person getting vaccinated.
Mask wearing is often a big topic for discussion with people. When you wear a mask properly, does it cause any toxicity or oxygen deficiency?
No, medical masks that are worn properly do not cause any oxygen deficiency. Oxygen can freely flow in and out of the small spaces, and there's no buildup of CO2 for the same reason.
Well, thank you, Dr. Gevas, for taking some time to help us debunk some of these myths that are out there today. Please remember that if you'd like to make an appointment with Dr. Gevas, please give us a call at 740-297-8640, or let us help you find another family physician in the area by calling us at Genesis OneCall at 740-455-7500. Thank you and have a wonderful evening.
Thank you, Lawrence and Dr. Gevas. Next, I would like to introduce to you Maureen Manili and Melanie Pointer from the Genesis Food and Nutrition Services. They're going to give you a behind-the-scenes look at what they do at Genesis Hospital and debunk some common food myths. Welcome, Maureen.
Thanks. Hi, I'm Maureen Manili. I'm a registered dietitian and clinical nutrition manager for inpatient dietitians at Genesis. The Genesis registered dietitians are spectacular myth busters. We provide the correct nutrition information that debunks nutrition myths. Our clinical expertise helps patients heal through proper nutrition. Dietitians go through a required education, think lots of science, and pass a national registered exam prior to becoming registered. We are also licensed by the state of Ohio. Some of the responsibilities of clinical dietitians include nutrition counseling for patients on special diets or with special nutritional needs like high protein diets for wound healing, assessing if a patients are at nutritional risk, and giving them ways to improve nutritional status. Sometimes when a person's in the hospital, this may include supplements like Ensure. If patients aren't available or aren't able to eat, we help provide the proper nutrition support. We also help answer questions that patients have regarding everyday eating. The dietitian is a nutrition advocate for patients to make sure they receive the nutrients they need to feel better. Melanie Pointer is one of the clinical dietitians who has been with Genesis 2.5 years and covers the intensive care unit. She's going to shed some light on some of the more popular myths regarding food labels.
Hello. Our first myth that we're going to take a look at today is the serving size listed on a food label is the recommended amount for everyone to eat. Well, a serving size is standard. However, serving sizes are based on the amount that most people typically eat, not necessarily what they should be eating. So the serving sizes on food labels correspond to the numbers on the rest of the label, things like total fat, carbohydrates, sodium, cholesterol, and so on. So they act as a guide to determine what nutrients you'll get in a serving size. But it's important to keep in mind that serving sizes are not a one-size-fits-all. So you may need more or less of a serving than what is listed to be suitable for your current diet. So I'll just show you a quick example here. Just taking this package of crackers, looking at the back, it says serving size 4 crackers. So again, that just means what most people would eat, but you may need more or fewer than that. So if you need help determining what is a right amount for you, you can talk to your physician or consult a registered dietitian. Sometimes the food label can be hard to understand. Does a food label that always lists trans fat as 0 grams always mean the food does not contain any trans fat? Not necessarily. A food label is only required to list an amount that is 0.5 gram or higher. So a food could easily have less than 1/2 gram of trans fat, but not be listed on the nutrition facts panel. Most trans fats are found in commercially prepared products like cookies, cakes, pies, and crackers. If you're unsure if a food has trans fat, you can always look at the ingredient list, which is usually located below or next to the nutrition facts panel. So you want to look for words like hydrogenated or partially hydrogenated. If you see either of those words, then you'll know that that food at least has some amount of trans fat. And it is recommended to keep your trans fat intake to a minimum, as it can not only raise your LDL or your bad cholesterol, but it can also decrease your HDL or your good cholesterol. So we hear a lot of confusion about salt. One statement that we hear often is most of the sodium we consume comes from table salt. And that's not really true. Most of the sodium we consume comes from prepackaged, processed foods or restaurant foods. The Dietary Guidelines for Americans recommends limiting daily sodium intake to 2,300 milligrams. That's roughly equal to about 1 teaspoon. Most people typically consume about 3,400 milligrams per day on average. So in addition to not adding salt to our food, a good way to help control how much sodium you eat is to buy fresh or frozen vegetables and fresh lean meats, rather than things like canned or cured items. You can also read the food labels for packaged food items, and foods that have 140 milligrams of sodium or less are considered to be low in sodium. So let me show you a couple examples of those. So here we've got some breakfast biscuits, and just reviewing the nutrition facts panel here, you can see the sodium content for one serving is 125 milligrams. So that would be an acceptable low sodium food. Where on the other hand, this box here of macaroni and cheese, for each serving size, has total sodium content of 520 milligrams. That's quite a bit. So this would not necessarily be a food recommended for you in your diet. Another myth is if a product is labeled as natural, it means it's a healthier option. That's most likely not true. Although many people might assume that when a food is marked as all natural, it would mean things like the food does not have any toxic pesticides, or that no artificial materials or chemicals were used during processing. But that's just not the case. Unlike foods that are labeled organic, which we have right here, you can see it says organic at the top there, these have strict guidelines on what qualifies them to label their foods as organic. Using the term all natural is not regulated by the Food and Drug Administration or the USDA. So there's no guarantee that the product actually has fewer modified ingredients or had cleaner production practices than a conventional option. If you've been to the store lately, I'm sure you are seeing all kinds of products labeled as whole grain or multigrain. But are these the healthier choices? Well, it sounds like they would both be healthy options, but these terms can be misleading. Multigrain sounds like it would be healthy, but in reality, it simply means that the product contains more than one type of grain, such as oats, barley, cornmeal, or wheat, but not necessarily that the grains are healthier. It also only has to have 2 different types of grains to be classified as multigrain. And as for whole grains, only a small part might be made with whole grains. A company can put the term whole grains on its product label, even if only a minuscule amount of whole grains are in it. So it can appear to be a healthier option than it truly is. So when shopping for whole grains, look for the term 100% whole grain or 100% whole wheat instead. Thank you very much. I hope you enjoyed learning some new facts about your food that you can use the next time you go shopping.
I hope you enjoyed our program this evening, and thanks to all our presenters for helping us get to the facts. If you have not already added your name to the comments, please do so now for your chance to win a door prize. We'll accept your name for 5 minutes after the live program ends. Then we'll notify our winners via Facebook Messenger. Thank you again for joining us. If you're not already a Spirit of Women member, I invite you to join tonight by clicking the link below. And as a member, you'll stay up to date on all our new programs and have a resource to health education. And you won't want to miss being part of our programs for the fall season. Have a good evening. Thank you.